Hello and welcome to AFD TV. My name is Savita here with my dad, Dr. Sam, and Dr. Drury. Today we're going to talk about dementia.
Yes, that's right. So, Savita, you remember dementia, memory loss. So, welcome, Dr. Drury.
Thank you.
So, Dr. Drury, so what type of testing and even treatment do you do for patients with dementia?
Well, we can do neuropsychological testing. That's sort of the standard for diagnosing dementia. And oftentimes people, as early as 35 years old, people can start to notice changes just related to aging, normal aging. And oftentimes as we get older, we may be more stressed, there may be a lot going on in our lives, and we start to forget things and we're worried about it. And so what a neuropsychologist can do is do testing. It's objective data that can tell us whether what that person is experiencing is normal for their age or whether it's more advanced and might indicate that there is some kind of process going on in the brain.
So as we get older, we have more responsibilities, and sometimes just the stress and anxiety can lead to both forgetfulness and also ADD.
Right.
Yeah.
Now, ADD is a developmental disorder that is present in it. For the diagnosis of ADHD, there had to have been symptoms before age 7, or now it's a little bit later.
Sure.
But adults often have problems with attention as they become more stressed. And so they also have attention deficits that are related specifically to anxiety or stress or lack of sleep. A lot of things can contribute to problems.
So say if a 35-year-old is having, what is that again? Difficulty remembering things. And if you do testing and you see a lot of fast twitch, fast activity, that's more likely anxiety related?
Yes, and I think what you're talking about now is the quantitative EEG.
Sure.
Yes, and we can do, when we look at the EEG, we can compare them to another 35-year-old and see what's happening. If it's a 35-year-old, it's probably not dementia.
Yeah.
But when people are getting into 50s, if there's a family history of dementia, it would be worth testing. And neuropsychological testing is different from the quantitative EEG in that we actually sit down with the person and ask them to remember things and repeat them back to us. And do things with language. And so we're actually testing that function as opposed to looking at their brain activity through an EEG. So there are two ways.
Yeah, and then so there's a lot of my patients, for example, who are in their 50s who do have family history, and they're always afraid that they're going to get dementia.
Right.
So with testing, you can tell if they have if they're likely to get dementia?
Right. There's something called mild cognitive impairment, and that's a precursor to dementia. Around, half of the people who have mild cognitive impairment do go ahead and develop dementia later. And so if someone's having some memory problems, oftentimes what happens is we come in and they're fine, and that's a huge relief. But at other times, there may be some mild problems, but not something that would indicate full-blown dementia, and that would tell us we need to monitor this, maybe test them in another year, and see if it has progressed.
Got it. And now, if you do diagnose mild cognitive impairment and the patient is scared about developing dementia, anything they could do to help decrease their chances?
There are a lot of things. Exercise is one of the best treatments for brain functioning, for a healthy brain, and eating the right diet is very, very important. And also we can do neurofeedback. There's a program called Brightening that someone developed in which we can train people to self-regulate their brain and improve their focus and memory.
And my prescription for patients is tennis. Tennis, especially doubles tennis also. There's a lot of planning and training, racquetball, anything that gets your pulse up and your brain functioning. Also, what about coffee and tea and risk of, does it help delay dementia?
I'm not sure if there's any evidence that shows it helps delay dementia. There may be some out there, but none that I'm aware of.
I have researched a little bit about that shows that coffee and tea, and amazingly, which we don't recommend, even some things like nicotine. And have you heard about that?
No, but nicotine does it does really amazing things to help focus and to clear your thoughts. But then, of course, there are a lot of negative problems that go along with nicotine.
And we're not at the point that we recommend e-cigarettes.
No.
But, coffee, tea are natural, Keurig. And the best thing is really just using your mind and brain and moving. And
social interactions are very healthy for the brain. So when you said doubles tennis as opposed to
even singles. Because
Yeah.
you have to work, interact.
Right.
Just
Right.
going somewhere. A lot of the health insurances, even Medicare Advantage, is one of the things they offer is free YMCA membership. Where that way, if you're retired, I say get up and go to work every day by working out every day around others, socializing, interacting. So,
Exactly.
yeah, well, that's very fascinating, and I especially as we have an aging population. A lot of physicians are afraid to retire because they're afraid they're going to lose their minds.
Yeah.
Because as a physician, you generally have to stay sharp.
Right.
And working is a good thing.
It is.
Yeah.
Yeah. Or finding another hobby.
Yeah.
Yeah.
That's But hobbies are one of those things where work, you kind of have to go to work.
Right. That's exactly right. That's
Yeah.
exactly right.
That's right. So, well, very good. Well, thank you so much, Dr. Drury.
Thank
and,
you.
Thank you for watching AFD TV.
The medical advice provided in this video is informational and strictly the opinions of Dr. Samudrala and AFD Clinics. For a personalized medical opinion, please consult your primary care physician or visit one of America's family doctors' clinics today.